name's Diana Callahan. I live in Redondo Beach, and I have a healthcare concern. I think I sent my question in, I'm not sure. But I think this is an issue that impacts people my age and older, and particularly those people who are members of CalPERS. As Mr. Seo can say, CalPERS makes promises that if you work for 20 years, you're going to get free health care. That's a lie. It's not true. What I have learned over the last 4 months is that CalPERS has no oversight, zero oversight. If you have a problem with CalPERS, they handle it themselves, and there's nobody outside of CalPERS who you can go to address the issue. My other issue is with PBMs. And I know last year the governor signed into law a bill dealing with PBMs, and I feel like that's a good start.
Can you explain that more?
Oh, sure. A PBM is a prescription benefit manager. And so if you have, especially if you're on Medicare, you have a company like CVS or OptumRx or something of that nature. They are the ones who actually fill your prescriptions. Medicare is not in the prescription drug business. What they do have is a formulary that says Medicare is going to pay for all of this. Well, then it gets to the PBM, and the PBM then says, okay, we're going to cover those, but we're going to put obstacles in your way before you can get it. So in my case, I have 2 medications that I've been taking for 30 years for an unusual condition. A few doctors treat it, and the new PBM that CalPERS has signed up with is CVS Caremark. And CVS Caremark is now saying there are quantity limits and I have to get prior authorization. My doctor is a specialty doctor. She is a lone practitioner. She doesn't do prior authorizations. And their response to me was, well, pay for it yourself or get another doctor. She's been my doctor 30 years. That's not an option because of my condition. The interesting thing about my particular situation is if I was still working with Paul, I would not have to go through this.
Did you work at the Attorney General's office?
I was a supervisor.
Oh, okay. What section?
The special prosecution section. And for anybody that gets to vote for him, please do.
We're on public property, so.
I know, I'm just saying. So anyway, so if I was still working and over 65, that medication would be covered without prior authorization. But because I'm a retiree, over 65, it is not. So my request to you is twofold. One, I would like legislation that says if a PBM offers a formulary to the workers, that same formulary should be offered to the retirees. In addition, CalPERS should not be the people who are supervising themselves because they make decisions that affect people like you and me, and there is absolutely nothing you can do about it. I have literally spent 6 hours a day for the last 4 months trying to get somebody to talk to you. They say, I actually got a response from the president of CalPERS, and she said, Don Moles, who's the health guy, he will contact you right away. Well, we're now 3 months down the road, and he's not only is he not calling me, he's refusing to do so. So I have no place to go.
Okay. All right. Thank you. Thank you.
Nope.
All right. Yes. So thank you for sharing. I know your concerns are specific to CalPERS retirees, and yeah, as a fellow CalPERS member, I'm concerned to hear that. So I will look into it, but I think this touches on the larger issue of healthcare access and affordability.
And affordability,
Yeah.
seniors, I have now gone back to work to get my medication. I'm 67 years old. I have now gone back to work, so my medication is covered. It was promised to be covered.
So Medicare doesn't cover.
No, Medicare, because I'm with CalPERS, and CalPERS says if you go get another Part D program, then they cancel all of your insurance.
Okay. All right. Be happy to talk about the specifics of your situation. Yeah, have you contacted our office?
I sent a contact to your office.
Okay,
a
we'll
month or two
make sure
ago.
to follow up.
Thank you.